Just a bit of an introduction. My name is Jo Lally and I work for the Research Design Service North East North Cumbria, and I'm one of the senior methodologists, but I'm also, as some of you will know, the public involvement lead. So today came about after we held a session about a month ago now, looking at the new call for research for social care, and some of those researchers that attended that launch call last month are here today. And what we found is that although we do public involvement very well within healthcare, maybe we don't do it, and by we, I mean me, don't do it so well within social care environment. So today was about trying to redress that balance. So the aim of the session today is looking at how you can incorporate public and patient involvement into your work, identify what the research priorities are for members of the public, get some public input into research ideas for social care research, and have a plan of public involvement for your proposal. So we've got a mix of people here today. There are members of the RDS team that you'll recognise going across the screen if you flick through. There are also some academics from social care research. There are some researchers who have got limited experience and are just starting out on their research career. And we also have some very eminent researchers who have done a lot of research but still need help with public involvement. And then we also we've invited along service users, so members of the public who either have an interest in social care, are recipients of social care, or are carers themselves, and it's about getting their input into today's session. So I'm going to kick off things with our first presentation, and this is going to be kind of a double act, and I'll be helped with Wade. And I'm going to talk about the practicalities of doing public involvement. We spoke at the last meeting about what public involvement is and what we mean by it, so I'm not going to go over that. I'm going to look at how do we practically do public and patient involvement in the field of social care research. Wade is going to give us a bit of an insight into the organisation that he chairs, NESCA, North East Social Care Health Advisors. And then we've got a presentation from Claire Humble. It's great that Claire's been able to join us today because I know she's very busy at Newcastle City Council. I think there's a virus or something going around, COVID, I think possibly, that Claire's had an awful lot to do with the planning for. Not planning for the COVID, planning for the response to COVID. Sorry, Claire. And then we'll have a short break. We've then got two workshops which really wanted to be the focus of today. The first one is really to give the floor to our service users to find out what their priorities are. Are we as researchers addressing the important issues from a patient perspective, patient and public members perspective? So we'll all get magically split off into work groups, and they'll be facilitated by the RDS advisors. We'll come back together for some questions, and then you'll go back out again to slightly different small groups where researchers are going to present to you in no more than 2 minutes some of their ideas for their proposed research. And it will give our service users a chance to feedback and say, ask questions. What do you mean by that? What services are you thinking of? How are you going to do it? And we don't think that this second workshop is going to kind of answer all of those questions. It's just the start of a conversation, and maybe in a kind of a friendly, less threatening environment if you've never done this kind of thing before. So it's going to be very rapid fire. And then we'll have a few questions at the end. So I hope everybody's okay with that. So on to the main presentation. So I'm going to recap very briefly as to why public involvement is important, about when we can involve or we can include public involvement in our work, some of the practicalities of doing PPI, because I'm often asked, well, you say to be involved in developing the research question, but how does that practically work? How do we do it? And then I'm going to hand over to Wade, who's going to tell us a little bit about his work with NESCA. So what is public involvement? Involve defines public involvement in research as research carried out with or by members of the public rather than to, about or for them. And I think it's the with or by that we're really interested in. We want to take patients and service users with us and help us to develop research. If we involve service users right at the very beginning of this journey, it's more likely that that research will have an impact on them and their lives and the people that they care for, rather than telling them about it after it's done and we've missed the point. I will say as a bit of a caveat, when I use the term public, this for me includes patients, potential patients, carers, and people who use health and social care services. So I try and use public, but if I slip into saying patients, I mean public. So it's about anybody who has an interest or an involvement within social care. But also just to remember that quite often public involvement can be carried out with stakeholders as well. So we're doing some research at the moment with paramedics, and yes, the paramedics want to ask the patients that they work with about the research, but we've also got to ask the paramedics themselves because it'll have an impact on them. So it's about drawing in lots of those opinions. So when can we involve public members in our research proposals? And I've put up there, the researchers will be familiar with this, is the research cycle. So we identify a research priority area. We come up with a research question and we go all the way around. These are all the steps as a researcher that you take when you're submitting your application, and indeed when you're carrying out that research proposal. So researchers will often come and they'll ask me, well, when on this research cycle ought I be including input from my public members? And I'll have to reply back and say, well, actually, you can be involved in any of those steps. There isn't anything on there that public members can't be involved in. So it might not be appropriate for them to be involved in all of them for every research, but researchers should be asking the question at each one of those points on that cycle, what could I get from public members by asking them about this? What information could I get? What help could I get? So I'm going to take you around some of those today, some practical solutions, but the answer is you could involve public members at all points on this research cycle. So priority areas and research questions. So how do we know as researchers what the priority areas are? So we as researchers, I'm a researcher myself for half my week, I have the priority areas that are important to me because of the research that I do. The research that I do is usually about patients' experience of being involved in research. So I have my own area of importance, if you like. But that's just me. That's me as an individual. Public members that we talk to or patients also have their priority areas. They're often linked to either conditions that they have, experience that they've had, services that have been involved in. So public members have their ideas of what the priority areas are. Stakeholders, like I said about the paramedics, they also have different priority areas. Carers have different priority areas. And funders themselves also have areas that they want to look at in more detail. So for example, this particular call, research for social care, has been identified as a priority area. Another priority area that has been identified is work on chronic obstructive pulmonary disease, something that's acutely of interest in this area. So funders themselves can often drive that agenda. So there's lots of people competing for that priority area. But how do we find out from all these people what the priority areas for this particular research? We can hold local priority setting events, which really this is a small version of today. We're going to ask you, as people in the North East North Cumbria, what's important to you. Excuse me. There are also national priority setting events, and some of you will be aware of the James Lind Alliance, which is a very rigorous process where they contact lots of different stakeholders around a particular topic. It could be diabetes, for example, and find out within diabetic research what are the priority areas. So there's lots of different ways that you can identify those. And then are we asking the right question? We might have an area of a topic in mind, but have we as researchers got the right question? And how do we know we've got the right question? And that's where I think public members come into their own, because they can say, well, I can see what you're trying to get at, but have you thought about asking this in addition? Have you thought about asking it from a patient perspective? Have you considered these elements? So you can go out and ask those public members. You could come to the Research Design Service Consumer Panel. That's a plug for our patient members who are on here. Some of you will have heard of Voice. It used to be Voice North, where you can go to and ask people if they would like to comment on your research, or you could set up your own public involvement groups. So lots of ways you can get that input. So in terms of the actual grant application itself, public members can be involved in the recruitment. So when you should recruit patients to your study, how you should recruit them. Is it quite often the patients or the public will come back to us and say, I wouldn't want to be approached about a trial when I've just been told my diagnosis. I'd like to hear about it a couple of weeks later. Public members are in an ideal position to be able to comment on that. The impact of the patient that the research will have, the number of tests that we expect patients who are signed up to the research, the number of visits, is that appropriate? Public members can comment on the ethics process. Is this ethical research? Are we doing what's ethically correct? There's also a large majority of it is around the public involvement plan. How are we going to involve public members throughout the duration of the study? This isn't a one-stop shop where you can ask public members what they think of your research and that's it. It's the start of a long-term relationship. Much of the work that the public members do is around that PPI plan, but also around the lay summary. Often the one piece or the first piece of a research application that the funding panel read is the lay summary. They want to know, is it understandable? Is it accessible? And public members are the only people that are qualified to write that lay summary. I deal with our consumer panel on a daily basis, and you would think I would be quite good at it by now. I'm not. I can't write a lay summary because I'm embedded in that language. So it needs people from outside to look at that. You have to excuse me. So you might involve your public members in co-producing your application or to review the current drafts. So there's lots of ways that can be involved in the actual application process. Your public members could form part of your research management or research governance. You could invite them onto your steering group. They become a co-applicant. Quite often they become part of a reference group where you can keep going back to them and asking for their input. They can also be involved in the evaluation of ongoing PPI. So you'll see that the types of involvement that they have and the opportunities of involvement are countless. Public members as well quite often are left off that final step of getting the analysis and the dissemination out to the public. We as researchers come up with the research message, but quite often if you ask public members what the research message is, they'll come up with something that's maybe significantly different. They won't necessarily be interested in publishing in the Lancet or the BMJ, but they might be interested in getting something in the Evening Chronicle that's going to impact on the care that they're receiving. So it's about asking them, what's the best message and where's it best to put out? Trust me to have a frog in my throat when I'm meant to be presenting. I apologise. So things to consider. How can you access your relevant public members for PPI? That's often one of the first things. How do I get that public involvement? So events like this, hopefully will kind of start to identify. I've said we have a consumer panel and we've got links in with lots of these other organisations. The public members are there, they're willing and enthusiastic and they're wanting to take part. How can you make your research more accessible to patients? You can ask them. There's lots of public members here today and they just want to hear about your research and they want to be able to give some feedback. They like being involved at a very early stage, so you're not going to them with a complete protocol and saying, do you agree with this? That's not what it's about. It's about going to them and saying, how can you help us to make this better, to be more reflective? There are barriers to doing this. Finding the patients is often a barrier, finding those public members. Being inclusive, are we as diverse as we ought to be? And that's difficult to get to some of those communities. And we've taken great strides to try and address this within North East North Cumbria and having lots of very different groups set up across the region. It's important not to be tokenistic. We're not ticking a box here. We're looking for proper involvement. It does take time. It's not a quick fix. It's no good coming to us and saying, we'd like to do some public involvement. And we ask, when's the application due in? It's due in next month. You can't do public involvement in that short space of time. It's about building up that relationship. And also it costs money. You know, patients and public are taking time out of their day to help you, and we need to reciprocate that with some funding. So that is often a barrier. We do have a public involvement fund within the RDS that you can apply to as researchers. Very small application, it's reviewed by our public members. And there's up to £500 available to help pay for some public members' time. And in the days when we could actually physically meet, refreshments, room hire and travel. But that is available to all the researchers here today. So if you want to discuss following today your public involvement plans, then you can get in touch with us in the usual way. So now, while I go and take a very big drink,